what's the awareness level in senior population about BPH and urinary incontinence treatments?
Thanks very much. I think it's a very important issue, and I'm very honoured to be with so many senior colleagues here. So I think we should just have everybody answer that question. I think that certainly men always think that they've got a prostate problem, and women often feel that they've got a bladder problem. And I think the reality from my perspective, having worked in this field for many years, is that there's often a bladder problem in both sexes, which increases with age. But there may, of course, be some obstruction in the male, and there may be a sphincter weakness in women.
Absolutely. But I prefer to begin with Poland and my friends from Poland, France, and UK. And then I finish.
Okay? So say who you are.
Hi, I'm Mark Speakman. I'm a urologist from the UK. I think the real thing we've got to pay attention to with our patients is understanding why they stop their medication. I think whilst it's undeniably true that in some cases it's because the drugs don't work, I think there's a loss of communication sometimes with our patients in explaining how long the medication has to be taken for, whether they'll get side effects and what the benefits are. So for me, one of the biggest messages is communication and getting better communication with our patients.
I'm Professor Bertrand Lukacs from Paris. I completely agree. I think, of course, evidence-based medicine is absolutely necessary, but it's not sufficient. We need to have other information about routine practice, because in routine practice, what we observe is completely different of what we want to do. And if we want to improve adherence to therapy in real life, we must have this data of routine practice, which are very different than evidence-based medicine.
Thank you. Piotr Chlosta, President of Polish Urological Association. I think that this meeting clearly indicates how important is parallel dialogue between the patient's organization and the urologist, and what is the necessity to looking from the urologist for the patient voice to put the treatment which is benefit, it's much higher than the risk of the complications. The topics touched by the most outstanding urological authorities preparing this urological session, offering our patients the best solutions to improve their quality of life. And this is the fantastic goal of the meeting.
Vincenzo Mirone, General Secretary of Italian Society of Urology. I think this is a great opportunity because here we have patients, we have general societies, we have societies of urology, ophthalmology, of the specialist societies, and then I think is the good topic where we can work together. This is very important to do, because I think the most important thing is to increase the attention of the patients, but it's necessary to have at the same state the postgraduate school teaching. Then it's a very important effort, common effort, to obtain this fundamental point.
Thank you very much.
And just to say, at a European level, we're working closely with the national societies, with colleagues and with patient groups to increase awareness, education and understanding of this important issue.